And joining us now, Wendy Bailey, Executive Director of the Mississippi Department of Mental Health. Hey, Wendy, how you doing today?
I'm doing well. How are you doing?
Doing great. Wanted to have you on to tell us about the Suicide and Crisis Hotline. We understand that it is much improved over the prior hotline. Tell us about that.
So back in October of 2020, nationally, there was legislation that was passed to take the 1-800 number for the National Suicide Prevention Lifeline and to change that to 988. So it would be like a behavioral health suicide prevention crisis line, with a much easier number to remember. Very similar to 911, this is 988. So
Gotcha.
It's 24 hours a day, 7 days a week, and provides people access to have someone to talk to.
And that now is a standard available across the nation. Is that correct?
That is correct. It launched across the nation on July 16th, so it's only been a few days now. And there's much buzz across the United States about that this is the first step in changing the crisis system for mental health, not only in Mississippi, but in across the nation.
Okay, so 988. And what can one expect if they feel the need, if they are thinking about a suicide or having some other personal crisis, and they dial that number, what happens?
You will get a trained counselor. We have 2 phenomenal Lifeline centers here in Mississippi, and they have made improving our answer rate in the state a priority, along with the Department of Mental Health, over the last several years. And in Mississippi, we actually have one of the top 10 highest answer rates in the nation. And
Wow.
So when you call that number, you will be routed to one of those 2 Lifeline centers. So you will be speaking to someone here in Mississippi, and they will talk to you about what you are experiencing. If it is a situation where someone needs to come out and respond, they will connect you with a mobile crisis response team. So
Wow.
we really talk about this in the fact of to have a good, strong crisis system, you really need 3 components. You need someone to call, and that's 988. And then you need someone to respond. And in our state, we have mobile crisis response teams in all of our community mental health centers. And they can go out and respond for where the crisis is occurring. And then you need somewhere to go. You need someone to call, someone to respond, and somewhere to go. And for us in Mississippi, we have crisis stabilization units and community mental health centers. And that is the connection of where you can go if you need even more help or a higher level of care. One thing that we do know about 988 is last year we had about 9,000 calls to the suicide line in a year. This launched the 16th. And they've already seen a 25% increase in the number of chats, because there's a chat component, especially for younger adults. And then we've already seen a 10% increase in calls just in the last couple of days. So we know we're going to see a need for enhancing and expanding the availability of crisis services because of 988.
How do the folks that are on those lines that receive those calls, how do they determine if the caller has a legitimate issue, and how do they discern that from a prank call?
It's really through talking. I mean, unfortunately, there are those situations, I'm sure. Same way with our helpline. We have a 24/7 helpline to connect people with services. But as you're talking to an individual and you are learning more about them and the situation that they are in, I mean, those things usually do come to light. These are trained counselors. The Lifeline Center, the individuals who answer those calls have to go through a very rigorous training, and it's continued training as well. So that's very important.
Yeah. So when someone inside the state of Mississippi calls, that number and the location of that individual is detected, that call is routed to the facility in Mississippi where the agents are housed to take that call.
That's right. So the call center in Jackson, which is called Contact the Helpline, they answered the majority of the calls in the state. There is another Contact the Crisis line, which is in North Mississippi, and they have several counties in the northern part of the state. So if a call comes in based on your area code, it's going to go to one of those two call centers. If all of the lines, if somebody's already on phone calls and there's nobody to answer, it rolls to the closest state. So it might go to Alabama or Louisiana. But that's one of the things we're really proud of is we've expanded the capacity of those centers to answer the calls that we answer in Mississippi. 89 to 90% of all calls that come through, which puts us, I think we're number 8 in the nation on the answer rate.
Wow. So 7 days a week, 24 hours a day, every day of the year, right?
Yes, 24 hours a day, 7 days a week. And we know that the chat component is something that is going to be enhanced as well, because especially with young adults, I mean, they're much more frequent to pick up a phone and text instead of picking up a phone and calling and talking to someone. So we want to make sure that we have the services and supports that are needed for all different age groups.
Yeah. Have we seen a spike in calls? Now, I know we've got the number, and it's certainly much easier to remember, and as a result, you would expect that there would be an increase in calls. But prior to that, have we seen a spike just in the need for these services and the calls into the center where folks are maybe having suicide thoughts and inclinations?
We have, if you look at the calls that we had in 2019 in our state compared to 2021, the last year that just wrapped up, there's about a 30 to 35% increase in the calls. So we absolutely have seen more people reaching out. I think some of that comes from, with COVID, I think there was a heightened awareness of mental health and how your physical health impacts your mental health. Just situations that were people were going through, the loss of loved ones or being quarantined or job loss, just different things that were happening, especially in those 2 years. I think that led to an increase of calls. We also saw an increase in the severity of the call or the length of time that someone needed to talk to someone. We also saw an increase in the number of mobile crisis response, the people who actually had to go out and respond to the situation. So we have seen an increase in need.
Is there any particular issue that seems to be the most prevalent that would, I guess, incline someone to think about committing suicide? Anything in particular there that you can discuss?
There are warning signs to watch for, and there are risk factors, absolutely. In our state, for young adults, it's the 3rd leading cause of death. Overall, for all ages, it's the 12th leading cause of death in our state. We think those numbers are probably underreported because a lot of times something may not be ruled a suicide that possibly was a suicide. But we do know that there's warning signs to watch for, and those warning signs sometimes can change based on the age group or the demographic. So, for example, with children and adolescents, a lot of times you will see, instead of depression and sadness, which is a lot of times one of the warning signs that you see with adults, you might see anger and aggression. You also can see sometimes you can actually have what is considered a brief point of happiness, of relief, and that could be because the individual has made the decision. So if you have someone that you love that's been struggling and going through depression, and then all of a sudden there's a very quick change, that's actually a warning sign that a lot of times can be missed. But changes in eating habits and sleeping, increased coping mechanisms like alcohol and drug use, all of those can be warning signs to of course, watch for. The most important thing is just for you to be open for someone to be able to talk to you. We tell people that we need to shatter that silence around suicide and bring that awareness and really just support your neighbors and your loved ones. And it really goes back to the golden rule. It's treating others the way that you would want to be treated, because you never know what somebody may be going through. But making a society open to be able to talk about it.
Yeah, makes total sense. Having that dialogue and that open line of communication, we as humans, we just need that. Simple as that.
Yes.
Wendy,
Yes.
thanks so much for joining us. Appreciate you updating us on the new number. It's 988. That's the suicide and a crisis hotline, 988. Thanks so much, Wendy.
Thank you for having me.
You bet. Middays will step aside for a break right here. We in the Element Wealth studios, and we'll be right back.